Greetings everyone, welcome to OROMIA11. Today we are focusing on a highly critical health topic, measles. Measles is a highly contagious virus that, despite being preventable through vaccination, continues to be a significant public health challenge worldwide and here in Minnesota. In recent years, we have seen measles outbreaks, largely due to declines in vaccination. There is a significant public health concern that our community need to know about. Joining us today, Dr. Muna Farah, a family nurse practitioner who works in a community clinic that provides primary care in Minneapolis. Dr. Muna Farah holds a bachelor degree in public health and a doctoral degree in nursing. She is a board certified family nurse practitioner, FNP BC. She provides a wide range family-focused healthcare services, treats patients of all ages, manages chronic conditions, and participates in preventative health care. Today, she will help us understand the current situation about measles infections. Today, Dr. Muna Farah will help us understand the current situation about measles and the science of vaccine, aiming to provide you with clear, factual, and science information. So stay tuned as we explore these critical topics with Dr. Muna Farah. Thank you for joining us today. Can you introduce yourself and what you do?
Well, thank you guys for having me here. My name is Muna Farah. I'm a family nurse practitioner. I work in, I'm a family nurse practitioner in a community care clinic. I work for OROMIA Medical Groups here in Minneapolis.
Can you explain what measles is and how it is spread and how it affects individuals who contract the disease?
Measles is a pretty contagious condition. It's spread by someone who has the measles virus has a cough, which is a symptom of measles. So if they cough in a space where you're at, if they're sneezing in that place, or if you're if you're in a contact, small quarters contact with someone who has the measles virus. Mm-hmm. That could be in a room where there is someone else who has the virus, or you're riding in an elevator with them, or you're in a school with them. So if anywhere where there is that contact between someone who has it and other individuals is really a breeding ground for the measles virus.
What are the common symptoms of the measles?
So one thing with measles is that someone can have the measles, has already contracted it and not know they actually have measles. So about 4 days before the symptoms start, you could already have measles. When after that 4 days, an individual can get symptoms that are like a cold type of thing. So a cough, a runny nose, tearing eyes, and then that fever and chills. And then as the days go on, an individual could have all of a sudden this rash begins. And the rash begins from sort of up here all the way down. So in the head, in the face, goes down to the shoulders and all the way to the body. And that rash can persist for up to 10 days. And it's itchy, it's uncomfortable, it's painful. The individual could have dehydration, not eat for a long time, not sleep for a long time. It's just a miserable feeling, miserable.
Thank you. Why is measles considered a highly contagious disease?
It's because how quickly you can get, especially if an individual is not vaccinated, you can pick it up quickly. So depending on if you went to a place where measles vaccine is not robust like it is here in the United States, or if you just were not vaccinated and you came in contact with someone who has it, with just coughing that air or that sneezing from that person, or just being in close quarters with that person, you can just pick it up just like that and pass it on fairly quickly.
Tell me about the trends. What is the current trend in measles cases in Minnesota, and how does it compare to previous years?
So prior to COVID, we were really we were really catching up to where we wanted to be, and where we want to be is that 100% vaccination rate, right? With the mumps, measles, and rubella vaccine. But then COVID happened, right? And we were distracted with that and getting vaccinated for that, and we didn't have the access. Community members did not have the access to the clinics, right? Because we wanted to prevent that and bring those numbers down. So our numbers dropped a little bit. So now 2024, now we're in the 4th month, right? So far we have 3 cases here in Minnesota, and a lot more cases in other states, but for sure 3 here. And we know that it's summer, and a lot of our people will be traveling and visiting other parts of the world, and so this is the time to really look into these conditions and vaccinations and preventative care.
Thank you again. And what public health measures are currently in place in Minnesota to control measles spread, and how effective have they been?
The public health measures that we have here in Minnesota is focused on education. We want everyone to know about vaccines, answer questions that they have regarding vaccines, and also the accessibility to get vaccinated, having walk-in clinics, having clinics where the folks that work in there or that they can call speak the same languages that they do. So accessibility being a lot more than it used to be. And I think that was being very effective prior to the pandemic, and we're hoping that that will go back to things will get back to normal now that we're sort of getting used to COVID and getting the hang of it. So our community efforts are really getting reamped again, so that we can meet the needs of the individuals that haven't been vaccinated for the measles, or are under vaccinated, or are not even sure if they have been vaccinated or not, and just want to be sure that they were.
Can we talk about the complications? What are some of the complications and serious health consequences associated with measles infection?
With measles itself, measles is really a painful condition. Again, anyone who has a lower immune system, that could be like our younger kids, folks that have health conditions, folks that do have, that are older, really get the symptoms way worse than others, right? But when you do have it, of course, that uncomfortable itch, that fever, that fatigue, obviously there's even more serious symptoms of like fluids in the brain, and being hospitalized for the condition, and death can happen. People can die of the measles. Sadly, it happens.
How effective is the measles vaccine in preventing the disease? Can you explain how the measles vaccine works to prevent the outbreaks?
So the measles vaccine is a 2-dose. First dose, if one just got 1 dose, is about 93% effective. If you get the second dose, about 97% effective. So I would have to say it's very effective. And if one gets it, follows that protocol of getting them together, then it is fairly effective.
There are some misconceptions surrounding the measles, like measles is harmless childhood illness, vaccines cause autism, natural immunity is better than vaccine-induced community, then measles is no longer a threat, the measles vaccine can cause measles itself, measles only affect children, those kind of misconceptions. How do you address them? So the measles vaccine for sure does not give you the measles. It prevents you from getting the measles. Measles, like I said, it's not for the young only. And again, if it was for the young, we want to vaccinate, right? Because we want our young kids to be healthy and thriving, right? But it's for anybody. Everybody gets measles. If you're
unvaccinated or undervaccinated, you can get the measles. For sure, there has been some false reportings related to the MMR vaccine and autism, and it has been proven to be false. The gentleman that did one study back in the early 2000s has made these false allegations, and they were found to be baseless. The World Health Organization did more research on this. Several other countries really focused on it, and here in America we looked into that. And we know that that study specifically was baseless, and so far up to this point there is no correlation between the MMR vaccine and autism.
Besides the vaccination, what other measures can individuals take to prevent measles transmission?
Okay. So if one is going out to places and you have not been vaccinated, I'm going to have to say you're at risk for getting the measles at any time. If you're traveling, even higher risks than anything else. So unless you're hiding under a rock or a basement somewhere and you're homeschooling and you're just staying only with your family, really there is not much. Like I said, I mean, this is more of a, you can get it just by being in a room with somebody who has it. So there isn't very much other than just, being in a basement or somewhere by yourself where you cannot be around other people.
So what advice would you give to individuals planning to travel to areas with known measles outbreak?
What I would say is, oftentimes you may not know that you haven't been vaccinated because you get so many vaccines when you're younger. Your kids get so many different vaccines for different things in the early years, and you might want to go on ahead and make sure that you've been vaccinated for the measles. One way to do that is we have MIC here in Minnesota, which is really a great tool. This is where all your vaccines records go into, and any medical provider is able to pull that up and show you what you have been vaccinated for and what you haven't been vaccinated for so far. So if you're missing the MMR vaccine, they will tell you that you're missing that, and then you can go down to any clinic. Really, all the clinics have that. Our clinic, the one that I work at, or the medical group, you can just come and walk in, and we will give you whatever vaccines that you're missing. You can go down to your own PCP, primary care provider, and check what you're missing, and they should be able to tell you. If you are traveling, there's a lot more that's given to you just for comfort and safety when you leave here. And so our travel clinics are really great about that. Those travel clinic nurses and doctors really know what's happening in different parts of the world. They want you to be there, safe and visit your family while you're healthy and well, right? So they will show you what vaccines you're missing. They will give you those vaccines. They will give you the information on what outbreaks is happening in the area where you're going. So I would say really do take advantage of the clinics that we have here in Minnesota. They're very, very knowledgeable doctors, nurse practitioners, and physician assistants that you can meet here.
I'm trying to wrap up my questions. Mm-hmm. Could you speak to the importance of collaboration and the coordination between public health agencies, health care providers, community organizations, and other stakeholders in measles prevention and control?
Absolutely. We have MDH here that really does a lot of research for us and really does a lot of important work for us. So where if there is something that us healthcare providers really need, we can just go on to their website and print that out and give it to our patients. We have our community health workers that go out there every day and can explain what outbreaks are happening. If you really wanted to know what mumps, measles, rubella is and what that vaccine is, if there's any combinations, they can come and sit down with you and really give you that extra time to explain that, and many times in the preferred language of the family that's asking about it. As healthcare providers, oftentimes only see you for 20 minutes, and you came there for something, and then we give you the vaccine. So we might not have, you may not get that time necessary to really learn every single thing that you need to know. You know, all your answers, all your questions answered at the same time. And community health workers are really great about that.
Thank you so much again. This is all I have for the day. Do you have anything else you want to add?
Thank you guys for having me here. Thank you.
We thank Dr. Muna for our today's conversation. We have now come to the end of our segment. Thank you for watching OROMIA11 and be safe until next time. Ergaan armaan gadii kun waajjira eegumsa fayyaa Minisootatiin isiniif dhiyaata. Gara biyya biraa imaluudhaaf karoora qabdanii yoo imaluuf karoora qabaattan isinii fi miseensonni maatii keessanii talaallii dhibee gifiraa, dhukkuba maampesii fi rubeelaa yookiin MMR fudhachuu keessan mirkaneeffadha. Dhibeen gifiraa dhukkuba baay'ee daddarbaa ta'ee fi yeroo namni dhukkuba kanaan qabame qufa'u yookiin haxxifatu qilleensa keessa babal'atudha. Talaallii fudhachuun immoo dhukkuba gifiraatiin akka hin qabamne nama ittisuu danda'a. Imalarraa deebitanii torban 3 keessatti mallattoolee akka laydaa yookiin dhaqna gubaa fi madaa diimatee qaamatti bahu yoo ofirratti argitan doktora keessanitti bilbilaa. Iddoo itti imaltanii turtan ibsaa fi odeeffannoo dabalataatiif liinkii armaan gadii kana tuquudhaan daawwadhaa.